More children than ever need mental health care, as figures show nearly 500,000 are awaiting treatment, guys. We're going to read into this exclusive from The Independent. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an exclusive from The Independent with the headline that more children than ever need mental health care, as figures show nearly 500,000 are awaiting treatment. Before I give my thoughts, if you can hit the like button, be greatly appreciated, and share this across social media so other people are aware of this video. Mental health, guys, we've talked on numerous occasions about how important mental health is. I've done a video on of all days my birthday to talk about with regards to mental health. It's something that's not going to go away. It's something that we need to accept that happens to people, and it needs to be dealt with and managed accordingly. Everybody's cases is different. But we're not talking about adults here. We're talking about kids here. We're talking about children. And it can have a detrimental effect on them. And I think it's fair to say that even in my childhood, I had mental health when I was young, when I was a child. But luckily, during my school years, is that I had parents who were willing to do everything and anything to ensure that I get the best chance possible. We certainly were not rich, but I would say that I had special care. I never went to any special schools or anything like that. I was in a public school, but I had the care that I needed to help overcome my mental health things when I was younger. But I still have some of those mental health issues. I still feel that I had when I was younger. I still have them today. That being said, it's important that those who do have them are looked after and given those assurances that they care. The very fact that we're looking at what could potentially be 500,000 children who need mental health care, that should be ringing alarm bells for you. That could be someone's mum, some parents out there who just can't afford to be able to pay for that need. And the best way and there are ways you can tackle it without having to pay out. There are videos and there are techniques. Simply Google mental health awareness. Simply look at on YouTube. There are many ways that you can tackle mental health without having to put your hand in your pocket, because back in my day we didn't have the internet. But we do have the internet now, and I do believe that it can help tackle mental health. There are people with, whether it comes to speeches or techniques and ideas that can help you and help your kids reduce the mental health on them. So my advice is to anyone who's watching this video, if you suffer from mental health, if your children suffer from mental health, or you know somebody in your life that suffers from mental health, and you can't afford it, it only takes a Google, it only takes a search on YouTube, it only takes just a bit of looking on social medias to find videos or techniques and reports and threads that can help you find the best ways to help tackle mental health without having to put your hand in your pocket. And I generally hope that helps you, whoever you are. So nearly 500,000 children are waiting for mental health treatment, with some youngsters left to languish for several years before being seen by medics in what is described as a scandal. This is a scandal. The NHS figures analysis analysed by The Independent showed a record 496,897. Under 18s have been referred by a GP for treatment under child and Adolescent mental health service, that's the Camhs, at the end of November last year, up from 493,434 the month before. So that's literally gone up by an extra 3,000 from last month, according to the analysis here. Anxiety and depression are the most common conditions for which children are being referred. One mother whose 11-year-old daughter is still awaiting treatment for obsessive compulsive disorder, OCD, said, "I don't want her to become suicidal with this. The system is so broken. Unless you're in it, you don't get how broken it is." In one area, Halton in Cheshire, figures show that some children have been waiting for 4.5 years to be seen by a mental health professional. 4.5 years, people. 4.5 years. That's a big chunk of their life. For a child, 4.5 years. Just think about that, yeah, for a child. 4.5 years of their life. Like, I get the NHS is struggling right now. I get we have a crisis in our healthcare service. I get that. But 4.5 years wait. That just shows just how little care this government has for mental health people. It really does. It's a really serious issue. Yes, there are many, many issues, many treatments, many things that the healthcare service needs to look at. But we're talking about 4.5 years wait here? Really? Is it really that low on the mark? Okay, cancer, of course, does take priority. People on deathbed and their lives in danger, of course, takes priority. But more needs to be done when it comes to our healthcare. And I think we can all agree with that. Nationally, the average time for those deemed to have waited for the longest is 675 days, around 22 months, while the average wait for all youngsters across the country is 107 days. Health experts have warned that the UK is facing a mental health crisis and have called for staggering demands to be addressed urgently. Tom Matters from the mental health charity Young Minds said, "Behind every referral is a young person struggling to cope and calling for help from a broken system." The shocking statistics come after the Independent published a series of exposures highlighting the poor treatment of mental health patients across the country, prompting the government to launch national reviews into the mental health care. The Independent can also report that a total of 289,000 children have been approved for treatment under mental health service but are still waiting to have their first appointment, an increase of 50,000 in just 2 months. 11 areas in England recorded under 18s waiting more than 4 years to be seen. Halton has average waits of 3 years and 8 months. There have been a huge increase in the number of young people aged 8 to 25 who probably have a mental health disorder, according to the most recent NHS data, up from 1 in 8 in 2017 to 1 in 5. Children living in households that cannot keep up with paying their bills were among those with the highest rate of mental illness. Professor Akira Ajua, apologies for pronunciation, Vice Chair of the Royal College of Psychiatrics Child and Adolescent Faculty, said in response to the figures, "It is clear that the mental health crisis is affecting children and young people must urgently be addressed. No child should have to wait for months of treatment, which is vital to their recovery and future well-being." She said young people who can access mental health support quickly are far less likely to develop severe and complex conditions. She called for Camhs to be provided with the staffing and funding to bring down the waiting list. Sean Duggington, the Chief Executive of the NHS Confederation's Mental Health Network, said the data lays bare the need to introduce waiting time targets for children's community mental health services, as well as to expand support teams in schools and open more early access hubs. It is yet more evidence of the staggering demand for mental health care from children and young people. While meeting that needs was challenging pre-COVID, in the face of a number of issues including historical underfunding, long waiting lists and workforce shortages, the increase linked to the pandemic had a major impact, he said. I don't think anyone is debating that the pandemic didn't have an impact on mental health as well as the rest of services. There's no question, nobody's making that argument. I don't think anyone can argue that pandemic did not have an impact on it. Deborah Woods' daughter Rachel, 11, has been waiting since March last year after referral by her GP to Camhs. Her OCD had become so bad she was refusing to wear certain clothes due to the fear of contamination. The young girl from Wee had been suffering from severe OCD since she was 6 years old when her first referral was refused because clinicians were told by her school that she was performing well. Ms. Woods said, however, a derogation of her condition forced Mrs. Woods to send her daughter to a private children's mental health service, costing the family thousands. See, private, again, when you go private, it's just going to cost you. Like, who has the money? After her daughter became ill again when schools returned after the pandemic in 2021, Miss Woods faced another battle to get her treatment. While she was waiting to be seen, one staff member advised Mrs. Woods that her daughter faced Mrs. Woods. Sorry, I'm going mad here. While she was waiting to be seen, one staff member advised Mrs. Woods that giving her daughter a face massage could help. How is that going to help? Sorry. You're really desperate. Being told to give your child a facial massage is just so soul destroying, she said. It was only after Mrs. Woods took her daughter to A&E in 2022 that Rachel was given 9 months of intense therapy. But in March 2023, Rachel needed support again as her mental health drastically worsened. It had been almost a year she was yet to be even diarrhaged by the service, which is now only seeing patients referred in December 2022. Describing the wait, Mrs. Woods says, when you're in this black hole of a system in what feels like you've no idea, you're referred by a GP. If you're lucky, you pass that. Once you're there, it's like, I don't know what's happening, and by the time you get seen, you are at this horrendous crisis point. When she was in crisis, Mrs. Woods said, Rachel would just lose control of herself. She would just scream on the floors in tears and just passing out. She was so ill she wouldn't go on grass at one point because she thought it was cheese and contaminated. This is just so depressing. Young mental health emergencies. According to the latest analysis of figures, urgent referrals for under 18s also hit a record high of 4,032 in November, an increase of 3,355 recorded the month before. The number of new referrals was the second highest figure ever recorded at 126,111 compared with the previous high of 126,857 in March 2022. If you've been affected by any of these stories, there's an email there if you want to speak to them. You can see it there. Mr. Madders, whose charities analysed the figures, said another month of record referrals is further proof of the young mental health emergency. This is incredibly distressing. Beyond every referral is a young person struggling to cope and calling for help from a broken system. How much worse does the situation need to get before the government is prompted to do something about it? Every young person should be able to access mental health support when they need it. And we need urgent action from this government to make it a reality. Meanwhile, separate figures analysed by the Royal College of Psychiatrics show that the number of people in contact with mental health, learning disabilities and autism services rise by nearly 500,000 in 4 years. According to NHS data published on Thursday, more than 1.85 million people were in contact with those services at the end of November 2023, up from 1.36 million at the end of 2019. Of those seeking support, 1.2 million were adults and 444,000 were children. The number of people needing support from learning disabilities and autism services more than doubled in that period to 266,000. Again, I'm going to go back to it again, guys, about how important it is to why healthcare is so important. An NHS spokesperson said the latest figures that the NHS is treating more young people than ever and expanding health services as quickly as possible with the current funding arrangements. The Department of Health and Social Care said with an additional 2.3 billion in annual funding, 345,000 more children and young people will be able to access NHS service, and mental health support teams in schools will cover at least 50% of pupils by March 2025. We've heard this rhetoric before about them throwing money at the problem, but it's still not solving the problem, guys. It's depressing, it's deplorable when I talk about mental health. And I know it doesn't get many views on this channel, but when I talk about mental health, because people sometimes feel like I'm hitting a dead rabbit, but it's one I take very personally, because it really can destroy people. It is so destroying, mental health, guys, and we need to understand that there needs to be treatment available to people. Healthcare really does matter to everyone. Healthcare is a fundamental right. It should be a right that everyone should have access to, regardless of what your situation is. I don't like this premise that the path that we are going down, the destruction of our NHS being torn apart, and I do fear where it's going under a Labour government, especially under West Streeting. I really do fear it. I just think that the healthcare service that we had before is not going to come back. And I do fear we may go down that path of ending up us having to pay out of our own pockets in order to live. That seems to be the path we're going to be heading. Why do I think that? Well, the Labour are showing no signs that they're willing to kick out all these private businesses and investors in the NHS. They showed no sign of it whatsoever. I don't think that. I mean, I'd like to think when they come into power that they'll change their tune, but I don't really have much hope of that, if I'm honest. And children are suffering because of this as well. Never mind just adults. Kids, the next generation, their futures are not going to be as easy as it should be. They should be given best opportunities possible, and they can't because we don't have the services that we were supposed to have 14 years ago. And that's that is down to this Conservative government. They have been in power for 14 years. Stop blaming the NHS. Okay, there's been one political party that's been in power for 14 years, and they decide where funding goes, how funding is distributed. They're the ones who have ruined our national healthcare service. So what do you guys think? What do you guys think about mental health? What do you believe? Do you believe these statistics are accurate or probably inaccurate? I've had some people comment and dispute figures, and that's fine. You're entitled to dispute the figures. But one thing is for certain: our country is in crisis, and it needs help. And I don't think anyone here is going to argue that. But anyways, do let me know what your thoughts are in the comment section down below. If you can, before you go, hit the like button, be greatly appreciated. Share this across social media and hit that bell notification icon so be notified when I upload another video. And if you want to financially support me, you can do so by joining me on Patreon for exclusive content or joining YouTube membership for just 99p. Thanks so much for watching, guys, and I hope to catch you all very, very soon.